Hello everyone, and thank you for being here today. I'm Dr. Rubin, and I want to welcome you all to the San Gabriel Valley Foundation for Dental Health Clinic. Today I'm going to share with you some very important facts about proper dental care. We have a lot to cover, so let's get started. In the mouth, there are not only teeth, but a tongue and saliva. In the saliva are bacteria, and these bacteria have funny names, like lactobacillus and streptococci. There are good bacteria in the mouth that aid in the digestion of foods, and bad bacteria that cause dental disease, such as dental caries. If you looked under a microscope, the bacteria would look like dots of pearls and little bars or like little squiggles. And when certain kinds of bacteria mix with the simple sugars in the mouth, they form acid. This can happen very quickly, in about 10 seconds. When this acid repeatedly touches the teeth, decay can form. The process of certain carbohydrates mixing with acid and forming bacteria and then causing tooth damage is called the chain of dental decay. We must find a way to break this chain. And the first way is to keep our teeth very clean. We do this by brushing with a soft brush at least twice a day. We use a fluoride toothpaste to further protect the teeth. The amount of toothpaste a child should use is the size of a pea. When you brush, make small circles on the tooth, progressing around the mouth. Make sure to brush the inside surfaces and the chewing surfaces. Finish by gently brushing the tongue. The bacteria on the tongue produce compounds that can cause bad breath. Flossing once a day is extremely important. We use dental floss to make sure there's no bacterial plaque left between the teeth. Toothbrush bristles, no matter how they are placed or shaped, can't clean between the teeth. When you floss, you gently put it between the teeth and floss the back side of one tooth and then the front side of the adjacent tooth. Floss by using an upward motion while the floss is in that C shape. Mouth rinses are another way to keep our teeth clean. However, mouth rinse does not take the place of brushing and flossing. The second way to protect against cavities is to rinse our mouth out with water if toothbrushing is not possible. This will get the loose particles of food away from the teeth. It is impossible to avoid all sweets. So the third way to weaken the chain of decay is to have sweets at times when we can brush our teeth, or to substitute good snacks for treats that cause decay. Pretzels and chips are better than cookies and chocolate. Better yet are fruits and vegetables that are healthy for the body also. Make choices that are healthy for your teeth and your body. A child that picks at sugary food, for example, cookies or cake, or sips sugary drinks for over an hour or so will have a greater chance of getting decay than a child that finishes their meal or snacks within 15 minutes. This is why snacking leads to decay. Remember that children's snacks do not have to be prepackaged food or sugar-containing food. Peanut butter, a protein, can be put on celery, on apple slices, or even wrapped in lettuce. Leftover meats, cheeses, and beans are very good choices. A dip can be made from plain yogurt for fruits and vegetables. To find good foods that are prepackaged, read the list of ingredients. Sugar and other forms of sugar, such as dextrose and maltose and corn syrup, should not be the first two ingredients listed. Among the packaged drinks, look for 100% juice on the label. Other products say contain juice, which means they're usually 10% juice and 90% sugar water. Since there is acid-forming bacteria in the mouth at all times, we can protect the teeth against acid by using fluoride on the teeth. Topical fluoride is the kind that the dentist puts on your teeth after a dental cleaning or prophylaxis. Then, by using toothpaste with fluoride, you get the most benefit out of the treatment. Another way to get fluoride is in the drinking water or in fluoride tablets. This type of fluoride actually works on the teeth while they form in the jawbone to develop enamel that is more resistant to decay. Another important thing that can be done is to seal pits and fissures that are prone to decay. A resin is bonded on the clean surface of the enamel and fills the grooves that usually become decayed. This process is called pit and fissure sealant. The question is raised as to when you start to take care of the teeth. We like to start as soon as the baby is born and after each feeding, wipe the mouth clean with a damp cloth. This will accomplish two very important things. One is that the child will not get used to a sour taste after feeding, and two, the child will grow up knowing that something happens in the way of hygiene after meals. This will become a habit and will last a lifetime. One of the main problems with young children is a syndrome known as early childhood caries. It occurs when the child falls asleep after feeding and milk, juice, and formula pools in the cheeks and lies against the teeth for extended periods of time. This causes decay, which progresses very rapidly. In a toddler, this can be extremely serious. Prevention is the key. The last bottle before nap and sleep should be plain water. If a child learns to fall asleep with a clean feeling in their mouth, they will always want to have a clean mouth before sleeping. The elimination of the bottle at the earliest age and the introduction of a sippy cup or drinking glass is highly recommended. The first dental visit should be at an early age. Most dental authorities agree that about 2 years of age is a good time. The visit should be one of fun and an introduction to the office and the equipment. Generally, children of this age have no dental problems, and the visit can be very enjoyable. Good nutrition can be automatically taught at home, and good eating habits can be easily trained.
Why are baby teeth important? They just lose them anyways.
Teeth are important for 3 reasons: speaking, eating, and cosmetic reasons. But there's a 4th reason that baby teeth are important, and that's loss of space. When a baby tooth is lost prematurely to decay, the other teeth around it automatically shift to fill in the empty space. This crowds and blocks the space the adult tooth needs, thereby making it impossible for the adult tooth to come in properly. This often results in the need for braces later on. Space maintainers can be very helpful in preserving the space between these primary teeth until the adult teeth have grown in. But more than anything, proper oral care at a young age is highly recommended.
Is there a problem with a bottle or a sippy cup?
There are no problems with either of these 2 items. They just must be used properly to avoid decay. There are 3 liquids that can be used in either a bottle or a sippy cup: water, milk, or diluted juice. However, at bedtime, only water should be used. This is the best way to prevent baby bottle syndrome, also known as early childhood caries. When a child uses a bottle or sippy cup throughout the day and it's filled with anything other than water, the front teeth will decay. This is called bottle mouth caries. If a child does not have their front teeth, it can lead to speech problems, delayed eruption of the permanent teeth, and low self-esteem.
When should children brush their teeth?
Children should brush their teeth at least twice a day, after breakfast and before bed. This helps create a clean and healthy mouth throughout the day and night. One of the first toys for toddlers should be a very soft toothbrush. Brushing should be done with the parent together as a fun thing. The child should get used to putting the brush in the mouth and scrubbing the teeth. You should make sure to find a toothpaste flavor that your child likes, but be sure it has fluoride in it. Fluoride rinses should only be used for children over the age of 3.
I don't have dental insurance for my children. Where can I take them for treatment?
The San Gabriel Valley Foundation for Dental Health is a nonprofit clinic that treats children from ages 2 to 14 that have no dental insurance and are eligible for the free lunch program at school. The clinic is located in La Puente, California in the greater San Gabriel Valley. The cost to be treated is $20 per visit, regardless of the amount of work that is performed. The clinic is open Wednesdays and Fridays from 8 a.m. to 12 p.m. You can call us at 626-934-2894 or go online at www.sgvfdh.com.